I'm a consultant pediatrician with Manipal Hospitals in Gurgaon. Today we'll be discussing about childhood asthma, and I think childhood asthma is something which is a bit of a bother nowadays, especially in urban areas. There are a lot of patients who come in with childhood asthma-like symptoms. So, in this Q&A session is mainly designed for parents so that they can have an insight into how to deal with children with asthma. So I think the first thing which comes to my mind is which children are prone for asthma. Now, there is no such definition that which children are prone, but it is basically any child who has recurrent coughs and colds, cough which probably doesn't come down easily with medications, and you see a child who often has to go to a doctor's office because of cough, you need to worry about childhood asthma in that child. Besides that, something which you must have heard doctors discussing about is wheezing. So, if you have heard wheezing, or if your doctor tells you that your child often wheezes, that could be an early indication that your child has atopy, or which probably at some point of time may point out to childhood asthma. But as I said, asthma is not a very straightforward diagnosis. There are lots of examinations, tests, and everything which we discuss and do. Then we come to a diagnosis of asthma. So some basic things which will tell you about that how would you know that your child is asthmatic. So three or four important reasons. One is if your child shows recurrent history of coughs and colds, which probably doesn't go away easily. Second, if there is anyone in the family who has history of childhood asthma, like immediate family, so there is increased chances that your child could have asthma as well, or rather atopy. Third, if your child needed or needs nebulizations or bronchodilators, like which can be from inhalers or nebulizations, then probably you are going on that pathway. Fourth and most important, if smoke or dust irritates your child and he starts coughing, sneezing, has issues with breathing, has chest tightness, then you need to worry that your child probably has hyperresponsive airway disease or asthma, as we talked about. And most importantly, if your child uh, shows post response to a bronchodilator, like when you give inhaled salbutamol or nebulization, if he shows positive reaction to that, he shows a positive improvement to that, then definitely you are going on that asthma route. So that's about it. The other question is how do you prevent it? So um, technically, prevention is all about how much you avoid exposure to those things like dust, smoke, pet dander at time, pollen, and all those things. Second is about some medications which are given to prevent asthma attacks. So once your child has a diagnosis of asthma, the next job for the doctors are to give you certain medications that will prevent serious event from happening. So, serious event you'll know by a child suddenly having breathing difficulty, he's having chest tightness, extreme cough. So, you need to prevent those things. So, your pediatrician will tell you about something called as a preventer, which is a inhaler or a nebulizer, which probably is given as a daily basis so that you don't have such attacks of asthma, as you can call it. Third and most important thing is to not to stop your child from doing exercises, because many a times parents tell me that after every exercise my child has attack of asthma, so better not to do it. No, it's not the right pathway. So he can exercise obviously, but then you need to ensure that he knows the critical amount of exercise that can trigger an asthma attack, and obviously stop before that. So your child needs to be made aware of the symptoms of asthma. So that's in a nutshell that what you can do. But again, as I said, you need to discuss with the pediatrician because every child may have different needs. So, do you want to give me any question? Do you have any questions for me? Then we can take it from there. So, preventing asthma in a 7-year-old, I think is a very pertinent question. Like, if you know that your child is asthmatic, then your doctor must have prescribed you some medications, which we call as inhalers. So, inhalers are of two types. One is something which stops attack from asthma happening at that point of time, and another thing is which prevents it from happening. So that preventer is that medicine which prevents such attacks of asthma. So that generally is given every day and one or two puffs a day. And they are generally low intensity steroids that help your lungs to get acclimatized to the changes to the asthma. It has been seen in literature that if you give low intensity steroids for some time, generally the airway conditioning which causes asthma attack doesn't happen. So that's a very good option. So that's medications. Besides that, general measures like inadequate dust exposure, not exposure to smoke, being aware of those triggers which cause asthma, these are all very important. So next question is, what are the steps to manage asthma attacks in kids at school? So a very important question. At school, we have seen many times asthma attacks occur. Important to understand is, uh, if your child is asthmatic, your school should know about it, and technically the school should have a place where they can treat such asthma attacks. Uh, if your child has asthma, you will have inhalers, and the school should be aware of how to use inhalers. The teacher should be aware. And if you have an asthma attack, the child feels that he's having chest tightness, it should be given as per prescription. And obviously, the child need to rest and let the parents know. And the parents should take the child to nearest hospital as and how as possible. So that should be able to do that. Yes, next. Yeah, so the factors that can cause asthma attacks in children, which you need to be aware of. So one foremost thing is, some children who have asthma, they can get an attack by a simple dust or smoke or viral infections and all those things. So it's difficult to prevent a viral infection, but obviously yearly flu vaccinations, proper pneumococcal vaccinations as per your pediatrician's advice, and obviously ensuring dust or smoke doesn't touch your child. All these things do help in preventing such attacks of asthma. Interesting thing is, childhood asthma is not like everlasting. Many of the children grow out of asthma, and as they become teens, the asthma is many of them completely grow out of asthma. So there's a silver lining there. So as long as it's not out of it, then obviously do some preventions that will really help. So, a 10-year-old gets frequent asthma attacks even after taking his medications and precautions well. What kind of reason? How can I manage this? Now, see, this is a very interesting thing, because many parents do say that I am getting frequent attacks, but then I take the medications. So I think it's not important that you take the medication, but how you take the medications. So are you taking in the correct way? So there is a process in which you take the inhalers. You need to discuss with the pediatrician, watch YouTube videos, ensure that the process in which you're taking the inhalers, the medicines you're taking at the right time and the right process. If the process is right, there shouldn't be a reason why, despite medications, your asthma is not being controlled. So yeah, so I would not agree with that. So there must be something which we are probably not doing right. Any other questions you have? Then we can discuss about asthma in kids. Sure. What steps should be taken to manage asthma attacks in kids at home and its immediate care? So, on the home front, I think being aware that your child has asthma has already been is a big important step forward which you have taken. So, as long as you're aware that your child is asthmatic, so you will obviously take some basic steps. So, one is overall hygiene of the house. Make sure that the house is dust free. Use air purifier, especially at the night time, and keep him away from smoke, any sort, like household smoke, cigarette smoke, and all those things. Ensure that your pets don't have a lot of dander, or if it is, then please try and vacuum it as soon as possible, so this will prevent it. Ensure that the AC is clean, there's no dust that's coming out of the AC, and obviously take your medications and just plan with your doctor, because there is generally asthma severity score, which we pediatricians do it for the children. So that tells us that how severe the asthma is, and then we can tailor your medicines as per your requirement. So takeaway message, I think, is most important thing is to get your child diagnosed with asthma at first. So if you know that your child has asthma, half your job is done. But then obviously you discuss with the pediatrician what are the best steps to do. So there are certain preventions you need to do, and obviously there's certain medication that we need to take. Once we have a good confluence of prevention and medications, a lot of us say that asthma is not as bad as it sounds, and it can be easily controlled and prevented. And obviously, and in the long term, probably your child may grow out of it. Hopefully, this helps. And I think most important thing is follow me on BabyChakra, so we can have these discussions over and on again. And then, if there's any other questions, feel free to get back to us. I will be more than happy to come back to you. Thank you.